We are back here on our big broadcast, the world-famous Cheeky Jaguar radio broadcast, iHeartRadio, of course, AM, FM, 247.com, TuneIn, iTunes, Radio Loyalty, and, of course, TalkShoe.com. And we have got a fantastic guest with us today. Dr. H joins us here on the broadcast, and this is one of the very few times that I had another guest on who couldn't say enough good things about the guest that we have on now. And when we had Ricky Rocket on, he just kept putting you over and talking about how great you were. And so I'm like, I got to talk to this guy. So I did all I could to try to hunt you down, and I'm glad we've got you today. So thanks for being on with us, my man.
Appreciate it. Thanks for having me.
Now, let's talk a little bit about your book, Sex, Lies, and STDs. This book, absolutely amazing. First of all, talk to me a little bit about the writing process for this book.
Well, yeah, the writing process on any book. I don't know how many of your listeners have written a book, but yeah, you're ready to tear your hair out because, you know, you really want to get every detail right. But once you kind of find your voice, it's very exciting because you realize, you know, we've got this crisis in America and no one's really addressing it. It's falling between the cracks, and you've got literally a real-life Handmaid's Tale. I mean, people are getting infertile. People are getting a whole host of long-term sequelae from these STDs, and it doesn't have to be that way, and there's a simple fix. And it's just sad that, you know, we can't do the obvious and take care of this problem.
We have got a great guest with us today, the author of Sex, Lies, and STDs, Rob Huizenga, with us today. They call him Dr. H, and he is fantastic, and he has joined us today here on our big program to talk about his fabulous book. Now, you mentioned that America is basically in the middle of an STD crisis. How many Americans get a new STD each year? Break those stats down.
Well, shockingly enough, every year 25 million Americans contract a new STD, and you know, and these are essentially the majority of these go undetected. And so this crisis that I'm talking about, just in the last 4 years, syphilis has gone up 80%. Gonorrhea has gone up about 70%, and in individuals less than 25, chlamydia has gone up 25-30%. So this is really, really a legitimate crisis with these steep, sustained increases. And, you know, maybe it's because of online dating. Maybe, you know, we're using less condoms. You know, the public health system is falling apart. Maybe it's because, you know, we're doing a much better job on AIDS, and we're doing a much better job on herpes, and people are kind of saying, you know, the worry's off. And the last thing is, I find all the time with my patients, people go, you know, if I have a symptom, I can just look it up online and I'll take care of myself. And that absolutely, unequivocally doesn't work.
We have got a great guest with us today, the author of Sex, Lies, and STDs, Rob Huizenga, with us today. They call him Dr. H, and he is fantastic, and he is with us today here on our big program. Now, your book seems to be stealing the hearts of reading enthusiasts everywhere. Talk to us a little bit about some of the elements that you draw upon to develop this book.
Well, I think that, you know, it really came about because of this shock that I had when I went on the Today Show with Charlie Sheen, and he announced that he had HIV, and then he just said offhandedly that, in a question from Matt Lauer, that he had had sex with individuals without a condom, and that, as you can imagine, just lit up the internet, and people said, oh, that enabling Hollywood doctor, how in the world could he allow that to happen? And so I'm like, what? You know, no one had ever criticized me in the media. I was like aghast. And so I was angry as well because people didn't know this simple fact. A fully treated individual with HIV, today the treatment is so powerful that you cannot, and this is surprising even to hardened doctors, you cannot pass on HIV to a partner even if you don't use a condom, if you're fully treated. If you're not treated or you don't know you have HIV, obviously it's very contagious. But that's that little fact that nobody knew, and then even people in the media weren't even checking that, no, if you have HIV and if you're fully treated, you no longer can pass it. And then the flip of it is, if you are an individual who's having sex and you take something called PrEP and you're having high-risk sex, you're having, you know, sex with people at high risk of having HIV, that also prevents the transmission of HIV. So these two new things, the full treatment of HIV as prevention and then taking a preventative anti-HIV drug, these both essentially stop the transmission of HIV. And the word hasn't gotten out yet. And so that's why I started writing the book, and then I continued writing the book with chapters on every STD, because I realized in every other STD, human papillomavirus, chlamydia, mycoplasma, there's similar levels of misunderstanding. And so I really wanted to get the word out to the American population what they needed to do to prevent these ubiquitous sexually transmitted diseases.
We have got a fantastic guest joining us today here on the big broadcast here on Skype Audio. We are discussing an incredible book. Dr. H is with us, Sex, Lies, and STDs. And this book, incredibly well written. Give us the profile of the typical reader who's going to love this book, my friend.
Well, I think people that are going to love the book are people like myself that maybe are a little bit older, from the 80s and the 90s, and just kind of taking a walk back how grim and gruesome things were in terms of HIV and sexually transmitted diseases back in the 80s, when, gosh, people worried, hey, I want to have sex, but it could kill me. And that was one thing. And then the new changes in the last 10 years, and I think that the younger individuals, people less than 25 and women who bear the brunt of STDs, are going to especially like this book, because they're going to learn about these preventative measures, the vaccines, learning not to shave pubic hair within 2 days of having sex. These tricks that we're going to do, not having drugs and alcohol around sex, that will markedly decrease their chance of acquiring an STD.
Now, Dr. H, why is America in such a bad shape in terms of detecting and treating STDs? Because you mentioned earlier that the medicine and the pharmaceutical industry have done amazing things to to kind of slow the process or help the process along. But why is America in such a bad shape in terms of detecting and treating the STDs?
Well, we're in horrible shape, as you say, for the following reasons. Number one, there's a lot more online dating where individuals, have sex with persons where they, God forbid, they detect a STD later. They don't even know the name and the phone number sometimes of their partner, and so this makes checking and contact of infected individuals much tougher. The other reason we're in bad shape is the public health system has collapsed. We're not educating people. And people mistakenly think, oh, if I have a symptom, I can go online. But, hey,
yes.
Big headline here, the way STDs present is with no symptoms. Mostly they're symptomless. And so, no, you can't do that. You need regular testing. And meanwhile, doctors are often out of the loop. And when people come in and say, hey, I want every STD checked, they often don't do that. They don't check for herpes. They don't check for mycoplasma. They don't check for trichomonas. And so even the doctors aren't doing their part. And then the doctors should also be identifying people at high risk. Heterosexuals with multiple partners, men who have sex with men, or women less than 26, people that use drugs associated with sex. They all should be getting tested at least twice a year. But no, doctors are too embarrassed often to ask sex histories of their patients. And so, again, that's part of the reason why we're in this mess with 25 million STDs acquired every year, and it really shouldn't be like that.
We've got a fantastic guest joining us today here on Skype Audio on iHeartRadio. Rob Huizenga was us today. Sex, Lies, and STDs. Dr. H is giving a lot of his time with us today to discuss this incredible book. Now, what's been some of the different reactions you've gotten on the book so far, Doctor?
Well, we have, in certain instances, I had graphic pictures, and actually right before the book came out, I changed it to drawings because, I want this to reach young individuals. A shocking study came out the other day saying up to 8% of men less than 13 years of age have had sex. So this isn't something that we kind of give to college-age kids. We have to show this information to young kids. And so the reaction I'm getting is some individuals look and go, oh, some of these drawings are pretty graphic. And I'm like, yeah, we have to get this information out. It's urgent. And, enough of this kind of hands-off, like, oh, we're going to teach abstention. that doesn't work. Then people use, do other high-risk activities, oral sex that they don't fully understand, and we don't lower the STD rate. We kind of switch them around a little bit to other areas of the body. So the reactions are, hey, I'm not sure my kid really needs this. And it's like, okay, you're a safe driver. Do you need seat belts? Yes. If your kid is a great kid, you still need to teach them about sex education responsibly. And all the studies show if you vaccinate your kids early, if you give them good sex ed, you do not make them more promiscuous. So this whole kind of thing, I'll address it when my kid gets a little more mature. Bad idea.
We have got a great guest with us today, joining us here on AMFM247.com, Dr. Robert Huizenga, and he is warmly regarded as Dr. H. He's best known for the surgical-free, drug-free approach to obesity he has championed over the last 17 seasons on The Biggest Loser. He has a fantastic new book, Sex, Lies, and STDs, and he joins us today here on Skype Audio to discuss this incredible, incredible book. Now, why do you think that this book will appeal to readers, Doctor?
Well, I think it's going to appeal to readers because, it's essential information that we all need to know. We are all interested in sex, even if we're monogamous with a partner, even if we're currently not engaging in sex. We all have friends who are. And you know what? Speaking of which, there was just an article in the newspaper the other day. 2 individuals got HIV infected from doing vampire facials in a VIP spa in Albuquerque, New Mexico. So you can get STDs non-sexually. You can get STDs potentially from dirty towels from an Airbnb renter. You can get STDs potentially from trying on clothes in a department store without underwear. You can get STDs by various other, romantic touching. People need to read this book, even if they're not currently, engaged in sex with multiple partners and are considered at high risk.
We have got a fantastic guest. He joins us today here on Skype Audio. Dr. H is with us. His book, Sex, Lies, and STDs. Now, what is the most likely presentation of these STDs? Because you mentioned all the various ways that you can possibly get them without having sexual contact.
Yeah, people think when they're going to get an STD, something's going to burn or sting or drip, and that's not true. The number one presentation of sexually transmitted diseases, whether it be human papillomavirus, even something like herpes or chlamydia or gonorrhea, is no symptoms at all. And this is, you can get rashes and you can get discharges, but the number one way is no symptoms or such trivial symptoms that you blow it off and say, oh, that's just an irritation or that's a yeast infection. And so this is why knowledge is so important, and this is why you need routine screening, and you need to know if you're at high risk, and then that determines how often you should get routine screenings, even if you have no symptoms.
We have got Dr. H joining us today, and he has a fantastic book out there, Sex, Lies, and STDs. He joins us live here on Skype Audio here on KFRK in Denver. And how many of these STDs can be prevented by universal use of condoms, Doctor?
Well, that's a great question because people go, well, I don't need to talk about this because I'm using condoms. And here's maybe the most shocking thing people are going to hear. Of these 25 million STDs that I said Americans are going to get in the next 1 year, only about 60% could be prevented with universal condom use. And people just, they light up and they go, gee, I thought 99% would be prevented. But the fact of the matter is the way condoms are used in America, basically only about 80% of pregnancies are prevented. And same thing with STDs that are passed through secretions, only about 80% of those are going to be prevented. But many STDs, like syphilis, like herpes, like human papillomavirus, are passed skin to skin. So condoms cover part of the skin involved in sex relations, but they don't cover all the skin that's touching. Therefore, they don't prevent many of the STDs, 100%. And that's why the rate is even way less than the 80% prevention of pregnancy.
We have got a fantastic, fantastic guest with us today. Very informative. Dr. H is with us today. Sex, Lies, and STDs is the latest from him. and he joins us live here on the World Radio Network. Now, I assume HIV is the most severe STD. What other STDs can basically kill people?
Yeah, everybody assumes, gosh, you know, if I'm going to have sex, the only thing I'm really worried about is the acquisition of HIV, because that's the killer. And that used to be true. Obviously, there's been huge improvements in the treatment and the prevention of HIV. But it turns out that today, HIV kills about 6,000 people a year. But HPV, human papillomavirus, kills over twice that number in terms of cervical cancer, rectal cancer, and oral cancer. Right now, I have 5 patients, all men, who have oral cancer secondary to HPV. And this is shocking, but HPV is currently the #1 biggest killer STD in America. And the sad thing is HPV now can be essentially totally, or at least 90% prevented with proper vaccination. And sadly, with this incredible vaccination that could save literally 10,000 American lives a year or more, only about 40% of people that would benefit from it have taken it. And this is probably one of the most shocking, saddest parts, and maybe one of the big reasons I'm glad I wrote this book, because if we can get even some of these people in for the appropriate vaccination and save their lives, again, it takes 20 years often for these cancers to develop after contracting this sexually transmitted disease, but if we can get the appropriate people in for the vaccinations, you know, then me staying up all those nights writing this book will have been well worth it.
Well, you have put a lot of time and effort into this book. We have got a great guest with us today. Dr. H joins us, Sex, Lies, and STDs. He joins us live here on our broadcast. Now, you talked a little earlier about the situation when Charlie Sheen went on the Today Show. Take me through that whole experience, because earlier when you were talking about it, you kind of felt like you got blindsided with the whole thing. Give me your thoughts and feelings on this whole thing, because that was kind of a big part of your life and everything.
Well, absolutely. You know, you think that, you know, you're doing a good deed, you're going on the media and you're explaining, you know, a critical disease, a disease that literally 75 million individuals have contracted over the last several decades, and you're trying to talk about the incredible advances, and then you have, you know, a celebrity that's coming forward to give more awareness. You know, one of the amazing things that Mr. Sheen did is, by his acknowledgement of that disease, it was one of the biggest education months, years, in terms of individuals going online and reading about HIV and reading about the advances. So I was incredibly proud of him, and he did more with that announcement that, of course, I will ever do as a doctor my entire career in terms of, you know, helping people and saving lives. But in the face of that, you know, to have newspaper articles coming out, you know, saying I was a vile, enabling Hollywood doctor for doing what any good doctor would do, trying to give the appropriate treatment instantly, and then giving partners of that individuals full information how they could continue to enjoy, you know, their normal lives without fear of passing the disease, you know. And to have a negative in something so positive shocked me and angered me. And, you know, that's the night I started writing this book, because I wanted that type of misinformation and, anger to be, what am I trying to say? To be countered by something positive, and the real spirit of what doctors try to do, which is helping people, both their patients as well as other people that could, gain insight from, our interactions with, more famous patients, and trying to do what we can do to help.
We have got a fantastic guest with us today. The book is Sex, Lies, and STDs. Dr. H joins us today here on Talk America Live, and he's discussing this incredible book. Now, is it true that pubic hair removal can increase your risk of getting an STD, doctor?
Well, that's another wild field that people haven't been aware of. You know, when I started out in medicine, you know, people that would get surgery would get that whole surgical site shaved. And we thought, oh, that'll keep that surgery site clean, and we can do our surgery and everything will be fine and the wound won't get infected. And lo and behold, people found out that when you shave the surgery site, you actually increase infections. And so it was with that in mind that we started looking at STDs. Now that pubic hair removal is universal in certain, you know, areas of the country, especially urban areas, and it's now kind of spreading to men and in addition to women, could the same process be at play? Could people shaving pubic hair, trying to quote-unquote be cleaner, could that actually be working in reverse? And the answer is it's true, because when you shave, when you remove skin by any sort of method, you damage the skin transiently. You make it easier for viruses, for bacteria to penetrate through the skin, and therefore in certain instances like human papillomavirus, herpes, and certain diseases like syphilis, you increase the chance of infection by up to 400%. And this is something people don't know. And it's not that you can't shave, but if you shave, we'd like people to wait at least 2 or 3 days for the skin to fully heal before they have sex. And then their risk will, you know, return to kind of quote-unquote normal levels.
Dr. H is with us today here on Skype Audio, live here out of Las Vegas, Nevada, AM 1520, and he joins us today talking about sex, lies, and STDs. And this book, absolutely, absolutely amazing. You have put a lot of information in here. How does this book compare with some of your other books you've written in the past?
Well, people are kind of shocked because it's a total different thing. And I started out, again, I took care of a patient, and you're kind of forced you know, to learn and become an expert when you're taking care of a problem. But my whole life have been in the sports world, have been an exercise doctor, have been a weight loss expert. And so, yeah, it was quite a diversion for me. You know, I started out my career as the physician for a national football team, the Los Angeles Raiders, and my first book was the similar dismay when I found out that it's very difficult to be an ethical doctor and to be an NFL doctor, the doctor for a professional team. Because you're under huge pressure, shock as it may be, you know, to, you know, patch that player up and under any cost get them back on the field or the court or whatever it may be. And so my first book, You're Okay, It's Just a Bruise, was kind of a chronicling of that life experience where, you know, you go from a kid in a candy store, oh my God, I'm playing catch with an NFL quarterback, I'm catching punts from an NFL punter in practice, you know, I'm going out, you know, we're drinking with, you know, as a team the night before a game, and we do camaraderie sessions, and you're like, oh my God, I got to pinch myself, I'm actually getting paid for this, to that grim realization like, you know, a player has a potentially life-threatening or quality of life-threatening neck injury, and you're being put under pressure to not fully disclose the extent of that injury to the player because management is afraid you're going to kind of play with their head and they're not going to be as aggressive as they would be if they know they have this potentially severe injury. And that's when, you know, the sweat comes on your forehead and you realize, you know, you have to do the ethical thing, but that also means you're no longer going to be working for that professional sports team.
We have got a tremendous guest with us today. Dr. H is with us. Sex, Lies, and STDs is the latest from him. He is a fantastic, fantastic guest. He has been very open with us today about his background, his career, the book, all the books that he's written. With this book, what do you want readers to take away from your writing of this book?
Well, number one, I think that it's a very informative but entertaining, you know, I mean, there's so much stuff that has happened in this world, you know, from the beginning of the HIV crisis to, this recent, syphilis crisis. I mean, syphilis, a disease that's doubled over just the last 4 years, neonatal baby syphilis is quadrupled. This is a disease that we had cured essentially in the mid-50s. So just for readers to go through this insane observations and what's gone on in our country, a very well-developed, quote-unquote, modern society, is really just amazing. And so it's kind of really, it's entertaining in that sense. And then the practical take-homes for all individuals and what they can do to help other individuals in their lives, whether it's friends or kids or whatnot, I think really makes this worth the couple of hours it takes to get through it. And even for me, researching it, I have to say that I'm a little bit humbled by, some of the key elements I was unaware of as a doctor for 25 years. That I learned, and I want to pass that on to doctors certainly, but it's all stuff that the lay public can also easily acquire. And we're having a lot of patients that read this that are informing and helping to better educate even their doctors. And so it's a critical field, and it's been neglected because sex is the last taboo in this country. We can show nude pictures on the internet, we can do a lot of things, but I was just doing a show in San Antonio, yes. And I was told, Rob, you can't say pubic hair. You have to say hair removal in a sensitive area.
So ridiculous.
This is San Antonio 3 weeks ago. So I'm glad you have a progressive radio show. But
yes,
this is an incredible taboo. Like, it's a family show, so you can't mention the word pubic hair. But we're exposed to all this stuff on the internet.
Radio.
And it's crazy. It's insane what's going on in this field. And like I said, I'm amazed as I kind of mire through it, how backward we really are when talking about these subjects.
We have got a fantastic guest with us today. He joins us live here on 96.3 FM in Boulder, Colorado. And, of course, Dr. H is with us. Sex, Lies, and STDs is the latest from him. Can oral sex cause STDs? What about French kissing? Break that down for me, my friend.
Well, yes, that's another surprise is people figure, well, I was just kissing. I just was doing romantic touching. And STDs can definitely be passed. There are, skin-to-skin diseases, whether it's chlamydia or whether it's things like syphilis, are very easily passed through romantic touching and French kissing. And then when you talk about oral sex, certain things like human papillomavirus and herpes are very contagious, and chlamydia, some of the bacterial STDs, chlamydia, mycoplasma, gonorrhea, and syphilis, are also quite infectious with oral sex. So, that's the problem with a lot of these abstinence education programs. For instance, I think Utah and maybe several other states, their sex education is teaching abstinence. And they have found that vaginal intercourse does go down somewhat, but then students just flip over to more oral sex and other types of sexual relations that they don't fully understand and that also can pass STDs. And so the rate of STDs tends to stay about the same if you teach abstinence or sex education, but the type differs, and so abstinence is not the way to go in terms of education.
We have got a great guest with us today. Sex, Lies, and STDs. Dr. H is with us. Talk to us a little bit about the 17 seasons that you did on The Biggest Loser, because that you probably learned a heck of a lot that you didn't know, being as well educated as you are. I bet that was an interesting time. Talk to me about that.
Well, that a lot of things I learned. Number one is, I've always been relatively thin my whole life, so I had no idea how biased America is. I mean, we've got 60%, 80%, somewhere in there are overweight in America, so I had no idea how biased and bigoted Americans are against morbidly obese individuals. And so, we'd be working out contestants on the beach, and then you'd hear all these catcalls, fat ass and this or that. That shocked me. I had no idea what they were up against. I think the thing I'm proudest about is my involvement on Biggest Loser is that through 17 years on the show, I think we showed America that people that are morbidly obese, by that I mean people that are 100 or more pounds overweight, are not lazy. They're not bad people. They're as smart as anyone else. They have genetic issues and life issues that have kind of put them in this position. And so I think that we showed America that they can go to a gym as well. And so I think we took some of the stigma off of somebody that's way overweight, showing up at a gym. And so that's the part I was proud of. We also, for the first time of any TV show, did a whole bunch of medical research to try to prospectively show what different types of weight loss approaches would do. And we, for the first time, had an exercise-based weight loss program. Most times people go, well, if I'm going to lose weight, it's just all based on diet. And we showed that, you can also lose weight by increasing your exercise and trying to just hold your calories constant. And so, those things I think were the most satisfying part of being on the show. And just by lowering the stigma. And there's some connections here, and I wrote about it at the beginning of the book. I think that I've had 3 life experiences. One of them is the stigma put on people with STDs, specifically HIV, that I felt when, I was involved in this entire incident with Mr. Sheen and was criticized myself. I've never really been shamed, so to speak, and with my approach to HIV, I felt some of that stigma. And also going on TV, I've got, we can talk more about herpes. I felt stigma there as well, even though I don't physically have it. But just talking about it, you feel the stigma. I felt that same type of stigma with these morbidly obese individuals being looked at and called, vile names. And then the third time I felt that was I was in a car and behind Marcus Allen when he was driving a car that he had won as the MVP of the Super Bowl, and he had changed out the license plates. And seeing him get pulled over and spread-eagled on the ground when the cops didn't recognize him, just profiling him and assuming he was a bad guy because he was driving a Ferrari and he was black, and seeing what the police really did to individuals of color, that's the first time as a white guy I realized, wow, the blacks are incredibly disadvantaged in our legal system. And so, there are some similarities between what I've seen in terms of racial issues, fat shaming, as well as some of the stigmas that are in this field of STD. And that's kind of a parallel that I've drawn in 3 of some of the more interesting things I've done in my career.
We have got Dr. H with us today. Sex, Lies, and STDs is the latest from him. He is just amazing. You're quite the speaker, my friend. I will have to give you a lot of credit for that. And a great author.
That.
He's put a lot of great books out there. Now, you were a valedictorian and all county and football, wrestling, track. What motivated you to get into medicine? With having a sports background like that.
I was always kind of, in sports in high school and college. I was just totally motivated, in sports as a wrestler. Although, oddly enough, my career in wrestling, losing weight, had a huge, bearing on my understanding of weight loss and, contestants maybe trying to cheat the system like we used to try to cheat the system in losing weight for wrestling matches. But, yeah, it's funny. My dad was a nuclear physicist, and I was always going to go into math and physics. But at the last minute, I just thought, gosh, maybe I should combine a little bit of my science background with a field that lets me maybe, stay with a little bit of sports and try to, get in medicine and try to somehow influence the world of sports and fitness. And so that was kind of the connection between, where my focus was in high school and college and why I decided, maybe sitting in a lab with a cyclotron wasn't really my thing. And this would allow me to kind of stay a little bit more in touch with people and my passion of exercise and sports.
That's fantastic. We have got Dr. H with us today. He joins us live here in our program. We're live today on 90.3 in Milwaukee, Wisconsin, 90.3 FM, and Dr. H is with us today talking about his incredible book. Now, you mentioned herpes earlier, and there's a lot of stigma around that. Why is that? Delve into that a little bit more with us.
Well, that's another phenomenal story. basically back in the 1970s, herpes was no big deal. You know, there's a couple of papers that we pulled out from prominent doctors, and they would talk about STDs and the stigma of that and the psychological ramifications. And there was essentially something said about all the STDs from chlamydia to syphilis to gonorrhea, and nothing mentioned about herpes. Then all of a sudden in the mid-'80s, a drug came out that could treat herpes, but nobody really cared much about it. And so all of a sudden, we think, you know, there was this whole big ad campaign trying to differentiate between the good herpes, oral or cold sores, and the bad herpes, genital herpes. And from that, all of a sudden, you know, and then there was a big Time magazine article we talk about in the book that came out, you know, saying how herpes was a scarlet H, and it was this horrible disease that, you know, affected your chance to get pregnant, which wasn't fully true and was a lifelong, non-treatable disease. And all of a sudden, that became the worst STD to get, when in fact of all the STDs, herpes probably has the least intense symptoms and the least long-term ramifications of any of the STDs. And so, you know, I said that I was feeling the stigma because I took a little bit of a stance against the show The Bachelor. Now, this is kind of America's #1 dating show, and they have a policy,
oh my God,
however,
this
where
thing is
they
huge.
yeah, where they basically kick off any potential contestant that has herpes. And I just think that that's furthering the stigma, not something a national TV show should do that's pushing themselves as a dating show. And it's something that should be talked about. And there are preventative measures that can be taken so that if you care if you have herpes, you can prevent it from passing on. And it just seems so short-sighted that they just offhand kick off people with genital herpes type 2. And the funny thing is, the last kicker is, the biggest epidemic right now in America is the passage of herpes type 1 genitally. So they're not even doing a proper screen and ejection process if their goal was to eliminate herpes. So they have a bad policy in terms of the control of herpes, and they have a bad policy in terms of, you know, not realizing that this is something that we all need to and can live with in peace without further stigmatizing it. And just in talking about that, it just, you realize that there really is stigma, because nobody. Oh, here's an interesting fact. Every different STD, there's a celebrity that has come out with it. There's celebrities that say, I have HPV cervical cancer. There's celebrities that say, I have HPV anal cancer. There's celebrities that say, I have HIV. There's celebrities for... There's never been a celebrity that's come out and said, I have herpes and, you know, I'm living with it. Never. It's so stigmatized. Not one person has come out and said, hey, I've got herpes. It's no big deal. In fact, when I have to do pre-movie workups for my celebrities, you know, they have to sign all these statements saying they don't have oral herpes. There's all kinds of people that lie, that try to circumvent the whole system. And, you know, it's just insane what they do for kissing scenes in movies, and the whole system needs to be changed, and it's all based on lack of knowledge and misinformation.
Well, if you could change the system, doctor, how would you do that? What would be some of your steps that you would do?
Well, the first thing that I would do is make people recognize that 90% of herpes, 80% of herpes is symptomless and causes no problems whatsoever. And that's both good, because 80% have no problems, and it's also bad because the 80% still can pass on the herpes, and that's part of the reason why herpes has increased to a point where, you know, 55 million Americans have it. But once we realize that herpes is no big deal, the symptoms are typically very transient and can be controlled easily with an anti-herpes medicine. Once we realize it's no big deal, it doesn't cause infertility, it doesn't cause death, it doesn't cause brain damage. When we realize that, we can live in peace with it. It's not a big deal. In Europe, herpes is not a big deal. They're not fanatical and stigmatized about it, so they don't talk about it and have the same negativity we do in America. Once we recognize that, then we can kind of move forward, and if people still are, you know, don't want to get it, there are preventative things you can take before sex that would lower your chance of getting it. And there is also condoms, and with those things we can markedly reduce any possible risk of transmission. But I think we have to center it around herpes is no big deal, and it's the most overrated, it's an overrated disease in terms of the type of symptoms you get, and really it doesn't cause much of anything deleterious. And so I think that that's the big message to be put out there.
We have got a fantastic guest with us today. He joins us live here in our broadcast, Sex, Lies, and STDs. Dr. H is with us. And you have written many a book, and you educate folks along the way. What's some of the next books that you're thinking about writing or that have caught your interest that you're wanting to put out there?
Well, I think the future, you know, I get passionate about things, as you could probably tell. I think the next big wave in medicine that I'd like to fully understand and then pass my understanding along is the whole field of anti-aging. You know, once we hit about 45, you know, some of the wheels start wobbling a little bit on our bodies, and that's a huge area where we're gaining a massive amount of insight over the last couple of years and decade. So I think that's the next big area that we all need to address. You know, we all talk about risk factors. You know, how high is your cholesterol? How high is your blood pressure? How high is your sugar? You know, because these all are risks for you getting a disease later in life. But the number one risk for getting a disease is what's your age. And so we need to look at specific therapies to slow the aging process. I call it the high school phenomenon. You know, when you go to your high school reunion, you see some people, you know, after like a 20-year high school reunion, they look like your parents, and you're like, what the hell happened to them? And then you see people that look way better than you, and you're like, hey, what are you doing? I want to take what you're taking. Right. So that's it. We all age at different rates, and that's what we're looking into. Why do some people age so much more rapidly than others? And we know people that exercise age slower. We know people that do drugs age faster. Those are the simple things. And so we're getting into that, and that's the next thing that I'm really excited about and that I'm going to go into, I think.
Well, one of the things, we have got Dr. H with us today, Sex, Lies, and STDs. One of the things that we do every year is we go out to Las Vegas to the Adult Video News Awards and Expo. And this last year, when we were doing interviews with the different porn stars, we were talking to various folks that do the medical part of the adult industry. Why is it that the adult industry seems to have a better grip on checking for STDs and making sure the performers are up to snuff as far as their health? Why did they catch on to that quicker than the quote-unquote regular medical world?
Great question. You know, in the porn industry, there's obviously less stigma. People are willing to talk about it. They're more open about their sexual history, and they don't have this huge stigma and baggage about it. And so they look at their own risk factors, and they check very frequently for sexually transmitted diseases, and that's an incredibly effective deterrent for sexually transmitted disease, and therefore they really can get at the core of the problem. And they also are very knowledgeable about prevention. And with those two things, routine testing and appropriate prevention, they can markedly reduce their risk of transmission. And so you're right, it's a paradox. You know, you have a group that on paper you would think would be at the highest risk, you know, comes in with very low rates of sexually transmitted diseases. And, you know, there have been a couple of highly publicized cases of HIV, but there's highly publicized cases of HIV in every walk of life. And I think the porn industry is to be complimented for, you know, a very extensive look. You know, we can always make things better, but specifically in the HIV world, they've been exemplary in terms of their preventative approach.
We have got Dr. H with us today. He joins us live here on Talk America Live. Sex, Lies, and STDs is the latest from him. Now, one topic that I want to get into with you before we let you go. You mentioned you're going to be working on an anti-aging book. What do you make of the big thing that is happening? It's happening in sports. Joe Rogan talks about it a lot. This testosterone replacement therapy. What do you make of all this?
Well, testosterone replacement therapy, basically, if you go back in my book, You're Okay, It's Just a Bruise, this is something that I was exposed to at a very, very early part of my medical career because we had a player, Lyle Alzado, who was an MVP defensive player who had multiple doctors from East Germany and other parts of the world where they were supplementing him with basically every muscle-enhancing substance. And so, testosterone was one of those. And so I learned very early on the pros and the cons. I think that clearly in men who have deficient testosterone is a very helpful compound to be added. Unfortunately, many of the quote-unquote anti-aging clinics add testosterone to individuals who have normal testosterone or near normal testosterone, and I think that's doing a disservice because, excessive testosterone does have side effects, raising your red blood count, making you more susceptible to clots, and there's a lot of debate about whether it increases risk of prostate cancer and heart attacks. And so when it's used, you have to screen very carefully for that and do special cardiac tests if you're going to go with that. So I think there's a difference between supplementing with normal levels of testosterone and supplementing with levels that are supranormal, which put people at risk, and there's a little bit of difference there. I think, fortunately, few people need replacement, but when it's required, it's very helpful. But just on standard, to give everybody that's aging hormonal therapy, I think is probably ill-advised, but, research is continuing. I think the key anti-aging approaches, are not hormonal. They're based on other oxidation reduction mechanisms, and testosterone is probably a little bit oversold, as is growth hormone, although they have their role.
Well, thank you for that. That is an honest look at that. You didn't scare everybody with steroids, and you didn't say, "Oh yeah, this is the greatest thing in the world." So that was fantastic. Thank you for answering that honestly, Dr. H. That was fantastic. Now, before we let you go, the book is Sex, Lies, and STDs. It's available on Amazon. It's also available in Kindle. And certain versions have a bonus 50-page STD capsule summary section. Before we let you go, how do people get a hold of you online, social media, if they want to buy the book, all these things?
Well, we'd love them to buy the book and comment on it, but maybe they could go to my Instagram site, where we do a little bit more interaction with the individuals, Dr. Huizenga on Instagram, and leave their comments of the book there. And we've got a lot of different medical inserts on that site that people may be interested in, including talking about that recent case of the two HIV contractions at the VIP medical spa doing vampire facials. So if people are interested in any of that, that's a good way to interact and put comments there, which we try to respond to when able.
Fantastic. Well, I appreciate you making time for us today. Thanks, my friend. And
okay, thanks
keep
for having
me updated on everything, and have yourself a wonderful day.
Great. Same to you. Thanks for having me. Appreciate it.
Thank you, Doctor.
Bye-bye.
There he goes, Dr. H. And we are going to take